Hi everyone, good morning. Good morning to you all. We are still waiting for the colleagues to join, but I think we should start. First of all, on behalf of UNICEF, WaterAid, and Global Handwashing Partnership, we would like to welcome you all in this particular session on multi-country experience of public handwashing facilities and launching technical guide on handwashing facilities in public places and institutions. My name is Dr. Om Gautam. I work for WaterAid as a hygiene lead, and together with me, I have colleague.
Hi everyone, and happy Global Handwashing Day. Happy that you're joining us today. And I'm Ann Thomas, and I'm the team lead at UNICEF for sanitation, hygiene, and institutional wash. So today is Global Handwashing Day, and in commemoration of that, we're hosting this session to launch the technical compendium on hand washing stations. And the theme of this year is why are clean hands still important? So we've seen this sort of inflection on hand washing post-COVID. It kind of became very important, then it became not so important, and now we're trying to mainstream it across public policy, but also practice. And so there are a number of really interesting initiatives going on now that will come out in this session, but also throughout the day. You'll be hearing more about this.
To perform behavior, to practice behavior, people need to do three things. One, people need to be motivated. Second, we need to have disruptive settings. So that means you need to have behavioral products, including facilities, soap and water in place. At the same time, we need to change the social norms. So today what we are going to discuss is all about one aspect of the behavior change, which is having facilities in place. And facilities are often a precondition for practicing the behaviors. If there are no facilities, how would people practice that? But having said that, still this morning, 25% of the households around the globe, 43% healthcare facilities, and around 33% of the schools in the developing world do not have hand washing facility and soap and water. And lack of these services meaning compromise in behavior, compromise on dignity, compromise on health, education, and so many other development agenda are compromised. It is in this context, this particular session being organized to share some of our learning about installing public hand washing facilities. And we have been doing that throughout the pandemic all across multiple countries. Many of us has done it into the sector. So therefore, we want to share some of the learning from WaterAid and also from UNICEF, including some case studies from the countries. Together with this.
Okay, so the first objective of today is to share the learning on the installation and promotion of hand washing technologies in public places. And specifically today, we're going to be thinking like beyond the traditional three households, healthcare facilities, and schools, where we've been looking, but really thinking about this as universal application of hand washing across multiple settings.
So therefore...
Oh, sorry, we didn't say the second one.
Absolutely, absolutely.
Sorry, and the second one was to launch the compendium that WaterAid and UNICEF have pulled together that kind of reflects some of these experiences over the years.
Thank you very much. And the unique of this is basically sometimes these guidelines and compendiums are based on expert opinion and thinking. But this time around, we are consolidating all of these learnings and then only developing the guide so that our future intervention will actually inform based on these guides. So we're going to spend another 80 minutes or so together. So what is going to look like our 80 minutes together? First of all, I'll start with WaterAid Global Learning on Public Hand Washing Facility. What have we learned from our multi-country initiative? Followed by Anne will lead accordingly from the UNICEF side. Then we'll have case studies from Nepal, followed by some of the private sector innovation on innovating public hand washing facilities, basically at household level on that particular instance. Then we'll launch the guide. We'll unveil the guide. Followed by, we'll then reveal what is there inside the guide, just briefly, and you'll have the chance to also scan the barcode to have that guide, and then we'll have the panel discussion towards the end of the session. So very packed agenda. Hopefully, we'll make it happen.
Okay, so first agenda item is that Om is going to share some of the WaterAid experiences on multi-country summary synthesis of public hand washing facilities. So over to you.
Thank you very much, Anne. So at the beginning of the COVID pandemic, WaterAid has implemented hygiene as position of hygiene as one of the key line of defense to COVID-19. And we have operated in 26 countries, including in 9 countries, very intensive, massive behavior change program. It was a 3-year program starting from 2020 to 2023. We have concluded last year. And we have operated in households, communities, schools, healthcare facilities, public places, workplace, and institutions. And the desire of the intervention was to raise the public awareness and also improve the COVID-specific, COVID-sensitive hygiene behaviors, following also installing public hand washing facilities in different locations. And we have, through our entire intervention, we have reached more than 240 million population, not only one time, 2 times, more than 80 times. But then also we have installed massive public hand washing facility. We have installed 2,700 public hand washing facilities in first year, and then 3,000 public hand washing facility in the second and third year. And today's my summary is going to especially focus on that aspects. What have we learned from installing those massive public hand washing facilities in those 9 countries? Just would like to reemphasize that we have installed at the beginning of the pandemic, there was a fear that, oh, COVID will transmit, even touching the tap when people are washing their hands into the public places. We have innovated a food-operated public hand washing facilities. We have installed them in various locations, at the interns of the community, at the schools, in the interns of the healthcare facility, in bus stands, various public locations. Majority of them were temporary, and some of them were semi-permanent facilities. But then we have also had a mobile temporary hand washing facilities. So that means the people actually pull the vehicle in any specific locations throughout the day, and then they close the day, and then second day they come and again offers the services for people. So what we have done, because we have installed 2,700 public hand washing facilities in the first year, then therefore we wanted to see, oh, are these facilities literally functioning? Because we do care about sustainability of what we do, sustainability of our services. When we did our functionality assessment, we found that only 25% of our facilities were fully functioning, and 40%, around 40% were partially functioning. So that means public facilities are literally not working at the beginning of the pandemic. And majority of those reasons were irregular supply of soap and water, location, the accessibility, the 50% lack institutional ownership, inadequate budgetary provision for operation and maintenance, and also duty bearer capacity for repair, and lack of cues and nudges to prompt the behavior. Those were the fundamental bottlenecks to make those facilities sustain. Of course, then we didn't want it to just leave as it is, right? So what we have done for the second phase, therefore, we went back into those facilities again. What we have done, we have identified some of the factors leading for non-functionality. We have redesigned the technological options, moving away from food operated to more traditional, because at that particular moment, after 1 year, there was lots of evidence showing that the taps are not literally an epicenter in terms of transmitting the COVID disease. So we literally wanted to move away from very kind of sophisticated food-operated but not functioning facilities. Then we have conducted the accessibility audit, disability audit as design, and we have also adjusted the design. We had a stakeholder engagement. We built the capacity for operation and maintenance. We have rehabilitated some of the facilities that those were not functioning already, mostly food-operated one. And we have relocated some of the facilities those were installed at the beginning of, at the junction, for example. We replaced them closer to the schools, closer to the healthcare facilities, and then also put some cues and nudges to prompt the behavior, and then develop a first technical guide at the beginning. These were some of the facilities for the second phase. Starting from the first phase, more on a temporary facilities, to, as you can see here in the second phase, more on semi-permanent. Some of them were permanent facilities. We transform them. We don't just leave them behind. We actually transform them into the second phase. As you can see in the second phase, we have installed and rehabilitated more than 3,000 hand washing facilities. So these were some of the facilities that you can see. Because we wanted to see the functionality, we have set up the longitudinal monitoring aspects throughout this pandemic, and then we have seen after the second phase of the intervention, the facilities, the functionality level has improved from 25% to 75%. And some of the contributing factors, the soap availability has increased, accessibility has increased, cleanliness has increased, the operation and maintenance practice has increased, cues and prompt also increased, and water supply has increased up to the 80%. The functionality is actually determined based on multiple factors. And one specific example that I wanted to highlight from Zambia, for example, in Zambia itself, we have installed 658 hand washing facilities. And those were installed in schools, in healthcare facilities, marketplace, bus stations, old homes, people's old homes, the port of entry, and so forth. As you can see, it's a very diverse locations where we have installed these facilities. And making this facility functional was a prime focus of that particular moment. Once the COVID it's not literally over. Once the pandemic is actually declared, we are over after where the threat is actually reduced, let's put it that way. What we have done, actually, we went back and we look our design principles and so forth. Then we started, of course, our work was continuing, and post-COVID-19 era, and then we started primarily focusing on more permanent and semi-permanent facilities. We have also ingrained behavior change elements together with those public handwashing facilities, put NUDS part of the intervention as one of the prime drivers, and operation and maintenance in place, and all of these, majority of those facilities were implemented under the ownership of the government. For example, some of the pictures that left-hand side that you can see here, after all of this learning, we are actually making all of these facilities more inclusive. Majority of them are permanent, even putting behavioral nods, for example, putting footprints coming out of the toilet to the hand washing stations, for example, putting hand washing, the finger pointing stickers, and so forth. The one striking findings from this particular third phase of the intervention, I just would like to mention that, provided all these facilities are there, I just wanted to flag from the school setting here. We have installed these facilities in 120 institutions. Provided all the facilities were there without NUDS and behavioral promotion, only 21% facilities were actually being used at the beginning. So that means not only having facilities is enough. So we have to then put behavioral NUDS and plus promotion together so that it maximizes the benefit. And then we continuously assess it. After the behavior change intervention introduced and NUDS intervention introduced, it went from 21% to 94%, yeah, the use. So what have we learned? This is my final concluding slide. Overall, there are lots of common challenges if you are thinking of installing public hand washing facilities. We should be mindful about lack of institutional mechanism, ownership and maintenance, the weak supply of soap and water, daily operation, no mechanism for wastewater management, a lack of skills to repair the design, lack of cleanliness, lack of inclusivity, location of the facilities, and lack of visual cues and nudges, reminders. Those are the common challenges that we face throughout the pandemic. Some of the recommendations going forward includes we should have an initial situation analysis wherever you install facilities, and let's have disability and accessibility audit at the beginning part of the design so that we don't need to again rework on the inclusivity part. Let's context specific inclusive technological design or product. Ideally, those products need to be ready so that you don't need to waste lots of time, particularly during emergencies. Contracting takes time. If you are dealing with emergencies, be aware that we have those contractors ready. The capacity to produce and repairs locally is quite key, so therefore we need to have the local masons or artisans capacity building initiative there. The co-design and tested prototypes need to have in place already, so that it adds a significant value in terms of having this facility already in place, and that was one of the reasons why we had developed this new guideline. And ideally install permanent and semi-permanent facilities. Temporary facilities are good in injunctions where the frequent hand washing facilities are needed. If we are installing temporary, let's have operation and maintenance plan, daily operation maintenance plan in place. And then of course together with the facility, robust behavior change campaign, including the NUDS, is very much identical. And having longitudinal monitoring process help us to identify the barriers and to repair and maintain. So those are some of the learning from WaterAid based on our learning on installing more than 5,000 public hand washing facilities throughout the pandemic. With that note, so throughout this presentation, we'll have, after 3 presentations, we'll have little Q&A in between. So therefore now I'd like to invite colleagues, Anne Thomas from UNICEF. She's the WASH advisor there, and she'll present a UNICEF learning from installing public hand washing facilities. Over to you, Anne.
Thanks a lot, So I wanted to just present a few reflections on some of our experiences over the recent past, and just some of the key sort of shifts that we're making in our hand washing programming, not only based on COVID, but also on other sort of trends happening in the sector. So first I'll start with COVID. Prior to 2020, we were really focused on 3 distinct settings for our hand hygiene programming: schools, communities, and households. But with COVID, obviously, it became so important for governments to have hand hygiene everywhere that it started to challenge us. Okay, well, how do we adapt these designs, our thinking to support governments? But it was also looking at, how do we mainstream them? Because it was going from being a sort of one-off emergency intervention to, it started becoming a protocol for businesses, for example, to have hand hygiene stations. So it went to this critical public health behavior intervention. We saw that the public response at a global level was that we came together in the Hand Hygiene for All initiative, which was a global advocacy initiative that was also supporting governments and responding to government demand for more support on things like mainstreaming and policy. And then now looking beyond COVID, it's really been about how do we mainstream, not only in policy, but in terms of our technological designs, but also looking at bringing hand hygiene into coherence with other things we're doing in the sector, for example, like IPC. So there are a lot of questions now on how we make this more mainstreamed. But just to give you a sense, we were also very much involved in evolving different designs. For healthcare facilities in Nepal, we looked at, how do we evolve a design that could accommodate multiple users of hand hygiene stations. In DRC, we were looking at markets. So we had a market in particular where we had 50,000 people visiting a day. And so how do you provide some kind of system where people can use it for hand hygiene? And sustain it. In India, across the country, this was a huge question, and it ended up with a compendium of designs. A lot of those designs are now in this manual that we pulled together with WaterAid, but a really useful resource for governments during COVID. Indonesia is, I was the WASH chief during COVID, and, it was really an interesting time where we were being asked for protocols that never existed before. For example, for businesses, how do we keep our businesses open and comply with government regulations that were new at the time, that they had to have hand hygiene stations. We knew that schools had to have hand hygiene in order to reopen. So we also developed a compendium of hand hygiene technologies for schools. But we were doing things differently. We were inviting the private sector, for example, into our WASH cluster meetings to sensitize them to the demand that was coming from across the country and the kind of designs that they needed to start thinking about in advance, because basically what we were seeing were really antiquated designs that tended to fall apart with shipment that people couldn't put together. And they were really, I guess you had a term for it, temporary designs or short-lived. They were short-lived in essence, and they were very expensive. So they weren't really meeting what we needed. But obviously, even before COVID started, we had a lot of lessons from schools and healthcare facilities. And, we were starting to come to some alignment on the kind of design parameters that were important. For example, in healthcare facilities, we knew that the facilities for the sanitation facilities needed to be outside where patients were coming in, but for caregivers, they needed to be inside near the point of care. For schools, we knew that these had to accommodate multiple students, and as Ohm was saying, like the nudge factor, and how do we build the hand hygiene environment to incentivize or promote hand hygiene. There were additional considerations, of course, in terms of how water was accessed. Is water shortage a concern? What materials are locally available? Will users be familiar with the technology? Is there a robust supply chain? So these were all considerations that were being discussed. And additionally, in the background, we were thinking about, how do we mainstream them in public policy. And I think around this time, we also started thinking about IPC. So infection prevention control was something that governments were really big on, and suddenly WASH got thrust into this role, even though IPC is only a small part WASH, hand hygiene, and a few others, but a large part of it is the health sector. But suddenly it became clear there was a gap and there was a vacuum in terms of responsibilities for IPC. And so one of the things that we are looking at also is how does hand hygiene become an entry point for IPC across multiple settings. So I mentioned that there is also a bigger effort afoot at the moment with WHO to develop the normative guidance for hand hygiene, and this will look at how we do hand hygiene in public spaces. So you see a list of the public spaces here, from shopping areas to marketplaces, transport hubs. And the idea with the new normative guidance is that they would look, one, at standards. So your typical, how much water is needed, how long do you wash your hands for, can you use soap or alcohol-based hand rub? But it will also look at behavioral approaches. So what has been working in terms of group hand washing in different locations. And then finally, something that is very different and new about these guidelines is that they're going to actually attempt to tell you how to do this, which is probably the trickiest part of this, because there is really no evidence at this point on how countries are mainstreaming this. We have some experience, but not enough. So I think this is it will be an interesting, evolution of the document, and I think we'll still see different iterations, especially on the implementation part of it. But it is an exciting new document that we're hoping will come out early in 2025, and will complement the compendium that we're sharing today in terms of, this is sort of higher level standards, whereas this is really a how-to in terms of how do you serve different locations. So I think on that note, I'll stop and hand over back to you.
Thank you very much, Anne. Excellent work. Well done, UNICEF, too. So with that, we want to move on. So our next presenter will be Upama Adhikari. She is the health advisor from Nepal, and she will be presenting learning from public hand washing facilities during emergency context from Nepal. Over to you, Upama.
Good morning, everybody, and thank you. I'm Upama Adhikari, working as Senior Advisor for Health in WaterAid, and I'm happy to present Nepal case on learnings from inclusive hand washing facilities in public places. So moving forward with my presentation, this is the first slide where I wanted to share the data of Nepal. It's the JMP data, particularly for the household level and healthcare facilities and school. When it comes to WaterAid positioning during COVID crisis, WaterAid Nepal was determined in order to coordinate, collaborate with the federal government and the local government, especially the Ministry of Health. And at the right time, it was the right requirement to have contactless hand washing station in place. So we designed and established those contactless hand washing stations with multiple other interventions. So today I'll be sharing about the learnings we had from the journey we took from having a temporary to semi-permanent to permanent hand washing facilities. To give you a bit background, WaterAid collaborated with the local government during COVID response and supported around 458 hand washing stations, out of which 97 was placed in public places and cross borders. There was some funding from FCDO and Unilever, through which we supported 311 contactless hand washing stations, particularly in healthcare facility and EPI clinics. We also supported them in order to prepare the O&M plan, also provided some few spare parts, and we supported this intervention into 6 districts across Nepal. When in second phase of the intervention, we realized, and when we monitored, we found the functionality of hand washing station was a challenge, particularly in one country. Therefore, we focused that, particularly in one district, therefore we focused on Bardia, which is in the far west region, where we repaired 105 institution hand washing facilities and also constructed 50 new hand washing facilities in school and healthcare facility. So that was a strategic move from our end, and we also supported the institution in order to develop the O&M plan, also trained them on O&M thing. Moving forward, this is the first design we initiated with. This is for a single user design, and some of the key features are, it is foot operated, one for water, one for liquid soap, and refilling of water and liquid soap was to be done regularly. Whereas the wastewater, there was 2 options, whether you collect it into the waste container and throw it into the drain or sewerage line, or you can have direct connection to the sewerage line. And there were some visual cues. We wanted to motivate hand hygiene behavior. So this is the first picture we handed over to municipality with the single user design, and sharing a few snapshots or pictures of hand washing facilities we placed in the public places during emergencies. Talking about advantages of these hand washing stations in public places, that it was foot operated and there was limited chance of having cross-contamination. It was easy to install, it was temporary, we could shift that hand washing station from one to another place, and optimization of water use for hand washing. So it was foot operated. And talking about challenges, refilling of water tank, refilling of liquid soap, as this was placed in public area, the risk of theft was always there. In case where the drain was not possible, wastewater container needs to be regularly emptied. And accessibility was one of the major challenge we faced when we talk about hand washing station. Functionality of pedal, loose-in connection, spring, and ultimately ownership of the local government was a huge challenge. Even despite handing over those facilities to those local entities, it was a challenge. Then we gradually shifted our design and did some modification, and you could see some of the key features. It was designed for 2 users. They could use it at the same time, and one is disabled and child-friendly, the other is not, and this was semi and permanent water. We had semi-permanent water connections. Gray water was disposed into soak pit or the drainage itself. Liquid container this time was a permanent structure, and the volume of the container was also slightly high. And we added some more views and nudges nearby the hand washing station for promoting the behavior. These are few pictures. We placed these hand washing stations near the entrance and exit of the healthcare facility and EPI clinic. Talking about the advantages in the second 2-user design, advantages were somewhat similar, but the change was it was child and disabled friendly. And the liquid soap containers was permanent structure, so the risk of theft in case of that was not there. When you talk about challenges, here too, there was a person who was responsible in order to operate the water pumping, so it was quite a tedious job for the person. And the risk of theft was again a challenge for us because of the placement where we had placed those hand washing stations, and refilling of the liquid soap was also a challenge. And the ownership, ultimately, it was a challenge again for us for regularly maintaining that and having the hand washing facilities sustainable or functional. But then with time, we gradually changed our design. We moved towards group hand washing station, much more permanent structure, good connected pipes, and good drainage. With very visual cues, you could see some footprints nearby the hand washing station in order to urge the patients or visitors who comes to a healthcare facility for seeking services. We especially focused on repairing the existing hand washing facilities, whether it was in OPD, waiting area, or the lab in the health facility. We designed a comprehensive hygiene behavior change package which had infrastructure as well as behavior change session elements within. The lessons we learned through our journey was through accessibility audit, our hand washing stations was accessible, and more importantly, the local government and stakeholders were sensitized on accessibility aspect. Having O&M plan and maintenance schedule always, that led to a sustainability aspect. And regular monitoring was also key. Ownership of the government and the healthcare facility staff, it was really important in our journey. And we should not miss the cues and nudges that really motivated users to use those resources we had placed. And this is all I wanted to share, the journey we had taken from having a permanent, from temporary to semi-permanent to permanent structure. If you wanted to know more regarding WaterAid Nepal's work, we have lists of resources on hand washing. And thank you so much for listening.
Thank you so much, Upama, for presenting the Nepal case study. Well done to the Nepal team. Now we just would like to move on. As you know, throughout the pandemic, the private sector I think significantly came forward and started helping to the sector by placing the public handwashing facilities, also making sure that these products are available, the behavioral products, especially soaps and waters, are available where necessary. Lots of innovation had happened in many countries. And today I would just like to show one innovation from Lexel. And for that, I would like to invite Annie Robinson, just to show the video.
Thanks so much, and good morning. Happy Global Hand Washing Day, and also thank you for helping me celebrate my 8th wedding anniversary. My husband and I are so committed that we got married on Global Hand Washing Day, and 2 years later we had a baby on World Water Day. So we are all in. My name is Annie Robinson. I am the acting director for the Partnership for Better Living, PBL. And PBL is a 5-year cooperative agreement between Lixil and USAID with a target of reaching at least 2 million people with improved sanitation and hygiene by 2026. So the reason I'm here today, I would imagine many of you are familiar with the Sato sanitation solutions, but I would like to introduce the Sato tap hand washing solution. I was hoping to bring one with me, but they were all snagged up for other hand washing events, which is great. So in absence of having one, I wanted to share this video that talks about the history of the tap as well as how it works. Do I just press? Oh, okay. On the. Great.
In our battle against a raging pandemic, one of the cheapest and most effective ways to combat the spread of disease is to maintain hand hygiene by regular hand washing with water and soap. But for billions across developing communities, soap and running water still remain inaccessible. Where water availability is scarce, improper hand washing facilities result in ineffective hand hygiene, leading to cross-contamination and faster spread of various diseases. With such grave conditions on the rise, Sato, one of the world's leading innovators and proponents of affordable sanitation and hygiene, embarked on a mission consistent with its ongoing work on SDG 6 to address inequalities in hand hygiene by bringing improved hand washing and hygiene to developing communities. Determined to help protect these communities, Sato's design team dedicatedly work towards an affordable solution and create an innovative hand washing station. Named after the most recognizable symbol of hygiene, Sato Tap is a smart solution to make hand washing simpler, affordable and accessible to everyone, everywhere. Specially designed for use in areas with limited access of running water or soap, Sato Tap uses its own reservoir, fed by many locally available plastic bottles compatible with variety of shapes and integral soap holder. Sato Tap can be easily and hygienically operated with a simple nudge to push down on either end of the nozzle using forearms or elbows. With the nozzle tapped down, the tap sustainably dispenses a steady stream of water, enough for proper hand washing. Pushing the other end down turns the tap off. With hand washing made simple and convenient, chances of contamination can be drastically reduced, contributing to stopping the spread of diseases. Sato is working with its partners towards bringing the most convenient hand washing solution to millions of people across the world. With the Sato Tap, basic hand hygiene is accessible to all.
Great. Thank you very much for Lexil doing such a fantastic work during the pandemic when it was deemed necessary to do so. And of course, there are lots of innovations into the sector from so many private sector. So we just included one as an example for you to reflect. With that note, We'll have a little Q&A in between before we go for the second phase of the sessions. The second phase where we'll be unveiling the guide and we'll discuss about the guide and we'll have a panel discussion. Before we do that, a little break in between so that you'll have at least time to digest and ask a couple of questions to the presenter. Any question to any presenter? Yes, please.
Thank you for the presentations. I was wondering about your first presentation, what the time frame was from the baseline to the final figures that you showed us.
Thank you very much. That was a 3 years timeline. So each year we had a longitudinal monitoring. We set up a baseline at the beginning of the year when we installed the facilities. That was first. Then we had a longitudinal in every year. So 3 years. Yes, please.
Yeah, thank you very much for the presentation. So Will from SHA. We do some work in washing schools. We're really keen on roof hand washing facilities. And we also do quite a lot of systems strengthening. I think for us it's around like how do you make stuff stick. So you see like with COVID or cholera, there's always this flurry of activity around hand washing, and then it's kind of that long-term stuff. So great to see that you operationalise that. But wondering, in terms of the recurrent budgets, for things like maintenance of some of these facilities, and the kind of wider scale up through systems strengthening work, just kind of how that looked and any advice to others on that.
Great. I'll start and I'm sure Anne will add on this. I think well, since the beginning of the pandemic, we are very much up to the center that these facilities are going to be white elephant if we don't operate and maintain and regularly reinforce the behavior over time. And we're very much mindful. And the way WaterAid operates, we work primarily with the local government and strengthening the capacity, and system thinking is always at the center of our work, and behavior-centric design is at the heart of our work. Having said that, at the beginning of the pandemic, it wasn't the case because it was deemed necessary. Government wasn't there at all available and in locations, and we needed to introduce the do no harm approach. Even like interacting with the people was out of scope because of the ban and everything. And also there was a fear of cross-contaminating if we run the hygiene sessions and so forth. But as the things progress, what we have done, we actually transformed the way it was designed and implemented. We put the operation and maintenance at the center, so that means the building the capacity of the right institutional mechanism. You know, even if WaterAid is not there, UNICEF is not there, if we build the capacity of the owner of that institutions is actually going to repair and maintain. That's one. The second, we started also looking what are the right institutional locations, the settings where you put the facilities, for example. We started looking the schools, the healthcare facility at the interns, for example. The case study that the Supama presented from Nepal was we have agreed with the Ministry of Health in Nepal to place those 300 hand washing facilities at the EPI clinic where people go for accessing the immunization clinic, for example. And the operation and maintenance, though we had the agreement with the government that they will allocate some budget for regular supply of water, purchasing the soap, and also operation and maintenance. So actually transform the way it has to be done. I think one of the key learning for us, if there are no right institutional mechanism in place, rather it would be safe not to install any facilities, rather regretting it. Because hand washing is not like other facilities, right? It does require a daily operation. You need to have soap, you need to have water, and you need to have like someone to taking care of that facility and making it clean is fundamental, right? So we as actors, let's not do the mistake of just throwing them, rather kind of institutionalize that since the beginning. Anne would like to add.
Really quickly to say on the systems front, I mean, one of the recurring issues with Washington schools is that it's an orphaned issue, right? And so you even have schools being built without facilities, period, right? Because it's neither Ministry of Education nor the WASH specific ministries, so, or health. So you have to not regulate, but sort of try and bring coherence to the accountabilities between the institutions first before you can hope to have this kind of accountability at the school level. But, you know, in the absence of that, you know, during COVID, we have worked with districts to support better planning. But again, it all comes down to ensuring there is somebody responsible first for the service at the school level, and then accordingly working backwards from that. And obviously with any service you put in a school, whether it's sanitation or hygiene, you're putting it into an ecosystem. And if the ecosystem doesn't have services like water or sanitation, fecal sludge management, then, you know, it's very hard to start building that out from a school level. So I think it's, you know, having this sort of holistic approach and recognizing the the broader ecosystem issue in tackling the school level issues.
Correct. Any question? Yes.
Yeah, I have my name is Evans Sisomane, and from the University of Birmingham. My question goes to the SATO hand-washing device. I wanted to find out if there have been any studies measuring the acceptability of it, like in terms of what, both quantitative and qualitative, how they perceived it and how it went. I was fortunate to see one in Ghana before coming to this conference, so they showed it to me. And one of the things that I wanted to find out was where the water was collected, because in most homes in Ghana, especially the Muslim communities where they have an important guest, the person sits in like the living room and they serve the person the food and bring the water to wash. And that brings to the point of the two bowls where they have to wash. So having this in there, how will the water be collected? So that's to add to the question about acceptability. Thank you.
Yeah, great question. Yeah, the product was developed actually in collaboration with UNICEF in 2020, and there's been a lot of interesting studies. I think last year GIZ did some research in school settings and found the product to be quite viable in a public setting for school children, and I've actually done some recent testing and kind of piloting in South Africa with GIZ as well. So we're kind of looking to prototype and develop more of an institutional level hand washing solution, but in the meantime sort of finding success with some research in certain places, primarily with GIZ as a partner, to think about how it might serve in a public setting as well. And I think to answer your question about where the water is coming from, it varies. I mean, you know better than I do in terms of what household level, what households are doing in Ghana. But we've seen a lot from, local water sources, et cetera, launching some studies in Guatemala, et cetera. So it varies, but, certainly happy to hear that you've seen it, and I'd be curious to hear more about what you've seen in Ghana.
Great. Any other questions? Maybe we can have maybe another 2 questions max. Anyone? No? Okay, great. Oh, yes.
Just more techie question. So with a lot of our work's in like rural Malawi and other places where hand pumps are prominent rather than pipe schemes, and I didn't know in your data sets whether you found that group hand washing facilities would require daily filling up versus that are connected to the pipe network. If you saw differences in kind of long-term sustainability.
Absolutely. I mean, that was quite evident. If you have the long-term connections connecting with the municipal authority supply or whoever it is, it's more permanent, more functioning as compared to refilling. I think refilling does require a daily dedication of a specific time for individuals. And I think what we have learned is wherever possible, I think connecting with the central supply system would be ideal, but it's not ideal in many occasions. So therefore, I mean, if in those occasions we need to have some dedicated persons responsible for that institutions, kind of agreeing to refill the water on a daily basis. Yes, the functionality is definitely where the connections is there on a regular basis. Yeah, great. Yes, yeah, final question. Thank you. Absolutely. Great. I mean, very good question. So in our study, I think operation and maintenance was one of the key driving factors not to sustain the facility at the beginning of the pandemic. And then we have put lots of emphasis in terms of like having the right institutional body in place, also the capacity building of the individuals from that respective cohort, whether this is the school management committee or health management committee or the boss management committee or the community owner who owns that particular facilities, and having that daily operation mechanisms, whether regular supply of water. So it was at the center, and we have seen the gradual improvement. Of course, we haven't reached 100%. We went up to 86% of the operational management progress into third year, but that was one of the definitely key. And I would suggest, I think, going forward, without having a robust operation and maintenance mechanism in place, I mean, the facilities are not going to be sustained. I think that's quite critical. And that should be part of the integral component. And this new guide that we are going to launch today is actually put these efforts at the center of that. Great. With that note, colleagues, I think we should move on. And we are going to actually go in a very exciting moment of this particular session. So what I would like to do, I'd like to now ask a couple of colleagues. I'd like to invite a couple of colleagues forward to unveil the hand washing guide. First of all, I'd like to invite Ann Thomas, please come forward. And then I'd like to ask Clarissa, please do come forward with us. And then I'd like to ask Robert from London School of Hygiene and Tropical Medicine, please come forward. And then Dr. Samira from Birmingham University, please come forward. So that we all can unveil the guide together. Yeah. So let's make it a little ceremonial, isn't it? So good. As we unveil the guide, you might see those unveiling happening at the back of this as well, and then we'll have the QR code. So yeah, let's unveil together. Yes, we can do that.
3, 2,
Yes.
2, 1.
Go. Thank you very much. Thank you, all the distinguished guests. And then with that note, I would like to now hand over mic to Clarissa, and she has to run to another session so that she can say a few words. Over to you, Clarissa, and thanks for being here.
Thanks. This has been very exciting. I've never done anything quite like this, so thank you very much for including me. I'm quite honored, very honored. So the session that I'm running off to prepare for is in fact the plenary that's going to take place starting at 10:30. And I think that what you're doing here fits in very well with the discussion that we're going to have during that plenary, and Anne is going to be part of that. And that's about the challenges that countries face in trying to take guidelines, in particular WHO guidelines, and turn them into policy and then turn that into practice. And I think what we've seen is that countries need quite a bit more support than is offered just by the guidelines that they get. And so this kind of intervention is exactly that bridging, that guidelines to help implement the guidelines that is really turns things into changes on the ground. So I congratulate you for having done this, and thank you very much for including me in the launch.
Thank you very much. And Clarissa is the affiliated faculty here at UNC as well, and also ex-colleagues at WaterAid. Thanks, Clarissa, as well.
Have WaterAid credentials.
Thank you very much. With that note, colleagues, you can you have the QR code here. You can download this guide, and we have just now we also unveil this in the website as well. So you'll find this guide publicly available in the public domain. So what I would like to do now, very briefly, in 7 minutes or so, before we invite colleagues into the panel, I just would like to highlight what is there into the guide. Because we just unveil, and you may want to see like what's there in it. What's there? The little bit of context, in which context we have developed this. Of course, we have discussed this already, but just would like to throw some enlightenment here. So for so many years, the UNICEF and WaterAid and other organizations, we have been working with the government to install these facilities, especially in public institutions, including schools and healthcare facilities. But during COVID-19, we were moving beyond the ritual settings, right? So ritual meaning schools and healthcare facilities, moving to marketplace, the public transport, public communal toilets, and also kind of closer to the communal toilets, and the restaurants and other religious worship place, and so forth, right? So lots of initiatives had happened throughout the pandemic to place these institutions in different locations. To support the initial, at the beginning of the COVID pandemic, we have developed the first guide, the first edition of this guide. But then Initially, as we discussed earlier, the majority of those facilities were more temporary. There was a still need to actually improve them, making it more permanent, and making sure that those facilities are functioning over time and sustainable. So because of that reason, the purpose of this revised second edition of the guide, and we are publicly making it available and launching today, is to incorporate more permanent and semi-permanent hand washing facilities, is not only having a design in place, but also the bills and quantities needed, the constructions note, the management and operation guidance, the highlighting also the advantage of disadvantage of selecting specific technological options in different locations, and also having a safety and accessibility audit tools and monitoring checklist. So this guide is a more comprehensive guide, is a step-by-step guide. If you are deciding to implement any public hand washing facility, what you have to do exactly from A to E, we have listed that accordingly into this guide. The scope of this guide, of course, as I mentioned earlier, the behavior change need a more comprehensive set of tools and approach, including motivating people, having these settings, the facilities in its specific settings, and also changing the social norms. However, this particular guide is not designed to promote behavior change. This is designed to make sure that at least we meet the precondition for behaviors, the facilities in place. So don't think that, oh, this is the solution for behavior change. This is not the solution for behavior change. This is a precondition for behavior change that we are actually included part of this guide. And therefore, it is in this context, this particular guide, based on the experience from WaterAid and UNICEF, implementing this type of technology in multiple settings, especially in low and middle income settings, we put this together, this guide to help. So within the guide, is a very long guide, by the way. I think it's almost 90 pages there. So this guide has a 3 chapter. In first chapter, we have included the initial consideration. Even if before you start thinking about installing public hand washing facility, what you have to do, part of your initial consideration, and some of the design principle. You're thinking of designing a specific technology, what need to be there, and then the technological adaptations, like how the various technology can be adapted based on the context and disease. Also, some of the design principle, we have put them as a key principle for installation of hand washing facilities. And some of the additional requirements, of course, there are specific settings where you need to add or more standards, particularly in healthcare settings. We haven't entered into the point of care into the healthcare facility, but we have included lots of examples from the healthcare facility at the interns and closer to the toilet, and also the management, operation, and maintenance. And these thinking should come at the beginning before you actually install the facility. So therefore, the first part of the guide actually includes those. The second part of the guide, we have divided into part 1 and part 2. Part 1, second part of the guide, actually includes the example of permanent and semi-permanent hand washing facilities from 12 countries. It does include a specific design description. It does include the strength and weakness of a specific design, the bills of quantities, and the actual cost needed for specific quantities, and then the different parts of the design, and actual design illustrations, and also the picture. You don't need to, for example, if you take this one, and then if you want to install this, if you have the people supporting you, you don't need to go for engineering design. You can have the engineering design plus the props, the actual picture, so that it becomes quite evident, and also including the cost. Cost might vary in specific locations subsequently because of inflations and so forth, but we try to actually add as an indicative cost here. The second part of the guide, within the second chapter, includes the example from COVID response from 13 countries. It includes the design description, advantage and disadvantage of those technology plus costing. Because, I mean, look, I think though the one pandemic is over, and these virus, bacteria, and they are there still into the environment. You never know when reoccurrence will happen, when another pandemic will happen, and we should be ready for that. So what we don't want to lose is what we have done throughout the pandemic, and we don't want to repeat the same mistake, but at the same time, we want to institutionalize that, what we have learned. So therefore, we kept this, but with improved versions. The third chapter, third section of this guide is actually the technical details, the protocol, and the monitoring tools, including the longitudinal monitoring checklist, and accessibility and safety audit checklist. So, for example, it's easy to say, oh, do a longitudinal monitoring. But when you say longitudinal monitoring, you need to have the capacity, you need to train someone, you need to have the checklist and everything. We felt that. I mean, look, I think both UNICEF and WaterAid, we do operate in countries, and we know how difficult to do these things. So we want to make these guidelines more practical and operational to the practitioners. So we put the checklist itself into the guide so that people don't need to rush and run for another locations to find them. And finally, it also has lots of reference so that, these are not only absolute guide, right? There are other reference material into the sector. I think at the beginning of the COVID pandemic, Hygiene Hub at London School also put some programmatic note, and there are like ideas also put some compendium together. There are other reference into the sector. We have listed them all here. So that's the guide. And happy to unveil today, and then those guide will be available. I'm sure those guide will be useful in your context as well. So, with that note, now we would like to move into the panel discussion. For that, I would like to hand over to Aryan, and Aryan will be facilitating that session, and Aryan works at Global Handwashing Partnership. And over to you, Aryan.
Thank you, and it was great to see the launch ceremony in that way. I think it's certainly a timely launch of the technical guide as we celebrate Global Hand Washing Day. So certainly an exciting day for all of us. For those of you who don't know me, my name is Erin Palomares. I manage the Global Hand Washing Partnership. We are a public-private partnership focused on hand hygiene, and we initiated Global Hand Washing Day in 2008. So it's really great to see how the day has grown over the years, and to see technical guides and further guidance coming along to sort of help enable some of these discussions around hand hygiene and elevating this issue even further. So at this point, I'd like to introduce all of the panelists and have them come up. I'm just going to read it off the screen here. Dr. Robert Drey-Bobes, who is a professor at the London School of Hygiene and Tropical Medicine. Please join us on stage. Welcoming back Miss Annie Robinson from Lixol. She's also a partnership specialist, and again, serves as the acting director of the Partnerships for Public Living. Dr. Samira Manaseki Holland, a public health physician and a senior clinical lecturer at Birmingham University, and then of course and Anne, if you'd like to join us as well. So we have a couple of prepared questions, but in this panel we'll dive a bit deeper into this question on how we can achieve functional and sustainable hand washing services in public places at scale. Samira, I actually wanted to start with you, because before this panel was sort of telling me about the research that you were doing in several countries around communal bowl hand rinsing. And so I was wondering if you could dive a little bit deeper and sort of share some of the implications of the research that you've done so far.
Thank you very much. Thank you very much for the invitation to be on the panel. And happy Hand Washing Day to everybody. So yes, thank you very much. As you said, I'm not a sort of a typical wash expert, but really quite moved and honored to move into this sector. One of the pieces of work we've moved into recently and trying to develop is this whole concept that actually mainly in Africa is where we've been looking, that there is mainly at households, but also at very many public places, including schools, particularly nurseries, funerals, churches, mosques, many places, where because of various reasons, including cultural reasons, not just facility and water access issues, that when people want to eat, especially before they want to eat, usually there is a bowl of water, and everybody in that that congregation or that school or that day present would basically rinse their hands and then go and eat. So this could be in a funeral, very many people. In a school, it could be very many people. In a household, it could be anywhere between 2 to 10, 15 people. Anybody who lives in Africa, I think, would probably recognize this. I think the unfortunate thing about it is that because it's so ingrained, it's a traditional practice, it's not, as I say, just out of convenience, that actually it's sort of fallen in the back of people's minds. So we've done a lot of hand washing exercises and promotion and behavior change programs over the years, decades actually. And as was said earlier, all these epidemics and pandemics and outbreaks have caused a lot of extra education and extra behavior change methodologies, facilities, and so on. People change their behavior. As soon as the event is over, they go back to the regular behavior. And one of the big issues, of course, about this is that straight after this communal hand rinsing, you can't really call it washing because there's no soap involved, people often go and have meals from a common bowl with hand. So actually, not only during the hand rinsing, you are passing around your infection or other people's infection to yourself, you also then come into a common bowl, which you then eating from further making the situation worse, really. So there is actually very little research in this area, but there is enough to say that there are some case control studies. So we've done we've done qualitative studies in Ghana and in Mali about why this is done and how and where it's done.
Mm-hmm.
We've also done a systematic review of the literature, which essentially, as I say, shows there's very little studies. There's virtually no intervention studies at all published. And there is good evidence during cholera, hepatitis, various other conditions that people who practice this behavior do pass on the infection. So there's solid evidence of that, and some laboratory evidence. Then we went on with WaterAid and Save the Children, and between them they cover around 17, 18 countries in Africa where they have WASH experts. So we had a survey of WASH experts as well as a qualitative interview with representatives from each country. And again, we found that every single one of those countries said that they know this practice exists in their country. It can be at household level, but particularly in public places, as was presented here. And indeed, many of the studies that are published are about nurseries, particularly. Some about schools, and one or two about funerals, but we know from our qualitative studies that it happens in many public places. So I don't know if I can link it to this guide. I think it's particularly relevant because obviously one of the issues about, in a public place anyway, choosing how to do your improved hand washing facility is to be able to do the assessment.
Mm-hmm.
And I think that's often something that is, even if you are a WASH expert, can be quite a technical thing to do. So your situation analysis, what's my situation? So what are the things I have to consider based on which I have to then choose something? That's often a difficult step to take, and I think this guide goes away towards that. Thank you very much. And the other step which is often missing is enough information for the agencies to be able to make a rational decision as to what kind of thing they need. So we all know there's very many devices and there are many factors involved, but actually to be able to bring that together in a manual and for people to be able to refer and say, this is the strength of this is the weakness of that. Now, I want to make a context specific based on my situation, a decision that I want to have a particular facility built and so on and so forth, look after it in a certain way. And of course, behavior change to go with that, methodologies to be able to achieve behavior change itself. I don't know if that's helpful.
Yeah, definitely. And it's very interesting to hear that type of research going on. I think there's certainly a lot of, cultural nuances that we have to consider with hand washing in public institutions as well. And so this certainly feeds into this discussion as a whole. Robert, I want to bring it back to you as another academic partner. Certainly academia plays a big role, and there is sort of limited research, but there is evidence as well. What role do you see academic partners playing to ensure hand washing facilities in public places and institutions, and how might you use and reference this guide in your work?
Yeah, thanks. Just echoing what Samira was saying, it's great to see this guide and have some structured guidance around a lot of the implementation aspects of public hand washing facilities. This really was, through some of our work with COVID-19 Hygiene Hub, something everybody was racing to do right at the start of the pandemic, and a lot of us kind of kicking ourselves as a sector that we never took advantage of learning this. I think a couple of ways that you can kind of see a role for academic or learning partners through this. It doesn't necessarily need to be with academic organizations, is even reading through this manual. You know, there's a lot of things like ensure facilities are acceptable. Well, what does acceptability mean, and how does that actually think? So there's a lot of kind of on the soft side of things, still quite a bit that we need to learn. I think that's probably things that work best with local partner organizations in terms of their understanding of the local context, the local needs, the local activity patterns, all of those types of things. That's really still a role for kind of a learning partner with this. In terms of the long term, thinking through things like sustainability, how do you actually design a study to assess the sustainability? How do you design a study of even the use of these facilities? There's a lot of interesting questions that come up. How many people use it, but what's your denominator if you're looking at any fractions of these types of things? So, you know, there's a lot of kind of really technical things that, as Samira was saying, these are quite technical things, and I think it's where learning partners can contribute. I also think, you know, it's great to see a guidance here on hand washing facilities, particularly targeting kind of low resource settings, but thinking through a lot about kind of our own experiences. At least, you know, I live in London. During the COVID pandemic, was walking around. There weren't a bunch of hand washing stations with soap and water. There were a bunch of alcohol-based hand sanitizers everywhere. They were at the entrance of every building. I couldn't get in the office without walking by 3 or 4 of those things. So I think it's also not just kind of what's the appropriate hand washing facility design, but what's the appropriate hand sanitizing material that we can implement within a lot of these as part of our kind of efforts to improve hand hygiene in a public space. And then, yeah, I think I can stop there and kind of hand over to the rest of the panel. So, yeah.
Yeah. No, I think you make some good points about appropriate design as well. And Annie, I know that you represent Lixil, who of course has the Sato tap. I'm curious, and I know you've sort of hinted at looking into some institutional designs in the future, but I'm curious, you know, what are your plans to improve Sato for public institutions, for example, you know, to allow group hand washing, for instance, and, you know, how can we make it more accessible and available in more countries?
Sure, thanks. Also great to meet you in person, by the way. Yeah. Erin and I have been talking on Zoom for many years now. So yeah, I mean, the Sato tap, as you see, it was designed with the household application in mind in the midst of the COVID-19 pandemic. Lixil has an ambitious goal of reaching 100 million people with improved sanitation and hygiene by 2026. So we've reached 68 million people thus far. So realize the need for more innovation, more product design, more partnerships to get us over that hump. So yeah, as referenced earlier, we are prototyping and testing some other hand washing solutions that would be potentially more viable for an institutional setting, whether that's healthcare facilities, schools, et cetera. But, you know, in the meantime, as referenced earlier too, like we are really excited about learning from our partners that they are seeing success in, you know, some public settings with the existing Sato tap. So we just launched some testing last month in Guatemala. So the Sato tap will be tested in household settings, but also healthcare facilities and schools as well. Likely to be starting something similar in Liberia. It's, you know, the reference to the research that's been done in Philippines and South Africa in schools found that the school children were able to use it effectively and notably used far less water than other types of competitive products. So we are committed to more innovation here, and, you know, stay tuned, but in the meantime, excited to see where we could make efforts through partnerships.
Great, thanks, Annie. Yeah, I think the innovation piece is especially critical, especially as we're looking at, you know, again, the sustainability aspect and really looking at more permanent solutions, but then also looking at stopgap solutions at the same time for, you know, low resource settings. And Anam, I know that you've shared a lot about your work already, and I want to bring it to you, and I think we'll hear more about this later in the plenary session, but of course, you shared in your PowerPoint, the WHO and UNICEF are working on some normative guidelines for hand hygiene in community settings. How do you see this technical guide complementing this work? And Clarissa sort of hinted to that in her remarks, but I'm curious to hear your thoughts as well.
Yeah, it's, I mean, just basically
we try and partner with WHO because they're the normative guidance, and we are really operational in so many countries. So we help and kind of bring the guidelines to light. And so developing these kind of, I guess I would call them like derivative guidance of the guidance, right, is part of our role as UNICEF. And so I see this being a direct support to country offices to try and unpack, the guidance from WHO is sort of up here, and then what makes sense at a country level needs to be really more digestible, I guess is the way of framing it. So this kind of guidance is really important for us because it really helps operations on the ground. So, normative is really important. Countries take it seriously, but they tell you what should be there, but they don't actually tell you how to get there, right? And so this is the how-to, and I think it's really important part of the equation.
Yeah, I agree. I would definitely agree with that. I think oftentimes we think about these bigger picture things, and I think it's definitely necessary to have, the guidelines from an authoritative figure like the WHO and UNICEF. But obviously, we know that those are very high-level documents that might not necessarily be as relatable to those on the ground. So certainly, I think this technical guide can play a big part in that. And I'm curious, and I know again you've mentioned this before, but with WaterAid, there has been a lot of change and learnings throughout COVID-19, and so I'm curious, how has your strategy changed post-COVID, and what do you hope people will get out of this guide?
So I think the biggest learning for us, like Anne mentioned, I think we are operational in many countries. When we are operating and supporting to the government, what you need is basically step-by-step guide that helps facilitate someone to make the right choice and install facilities in such a way that those facilities are functional, sustainable over time, monitor, taken care over time. We have done lots of learning throughout the pandemic. I think the WaterAid is strategically what we are moving is institutionalizing those learning. And one of the reasons why we have documented this guide is to make sure that those learnings are not forgotten, rather more strengthen our future programming. Having said that, also we always think two things from our perspective is quite important. We need to strengthen. We need to collaborate with the local government to implement this. When choices are made, we want to make sure that the choices are made based on experience, not based on expert thinking. And things are biologically plausible. Sometimes experts make decisions, but when decisions are made, it should be based on evidence and learning. So this guide will actually help facilitate to do that to the local government and also for our country programs and our partners. That's one. The second, scale implementation is quite vital. I think that's where WaterAid is actually moving towards. Thinking, we often consider thinking big and act fast. And of course, the acting fast should go from the government entities. So building the capacity of the right institutions, making sure that the right institution who holds the accountability to deliver has the right capacity to deliver. So working with government, thinking at the scale, because 2030 is just there, we still need to do a lot into this. So WaterAid has a mission to reach at least 400 million population before 2030 with our wash services, including hand hygiene. So in order to contribute that missions, I think this type of guideline help facilitate to speed up some of the process so that we just don't hang around still looking the same things that we used to before. So the COVID learnings is actually help us to galvanize all of those insights and move forward. So yeah, thinking big and acting fast, adding more insights to the sector from our end.
Yeah, thank you for that. Yeah, and I think this is certainly another great tool to have in our toolbox, right? So certainly hope that I can confirm that we will certainly use the content from this in our work. I think we might have a few minutes left. I don't know if anyone has any questions for our panelists while they're out here. Go ahead, Victoria.
Any further questions? No, you go ahead.
No, I think this is great, a great question, and I think we're waiting to see how the guidance comes out and what it looks like, because it's a little bit different because we have this pillar of it that is now dedicated to the how-to. But it's a bit chicken and egg, you know, we've written the how-to before seeing how it's being implemented. So I anticipate that we will need guidelines for the guidelines very soon, but I would like to see it kind of play out a little bit in the countries and get the feedback before we start doing that. 2 years ago, I launched the sanitation game plan, which was meant to be a guideline for the sanitation and health guidelines of WHO. But now we're launching, you know, the 8-step framework, which is a further distillation based on the feedback we're seeing from countries. But, you know, and sorry, you're probably going to hear me say this in the plenary next, but we're constantly oscillating from countries saying, you know, who do you think you are telling us what to do? And on the other hand, saying, tell us what to do. Just tell us what to do. Why do you have to make it so complicated and, you know, fancy? Just tell us what to do. And so, like, it's really an art form. I think this whole issue of developing implementation guidance, because you have to get it right. It has to be contextual, has to address all the key knowledge gaps. But you don't learn that until you're kind of experiencing how countries are experiencing it and what the real issues are.
Mm-hmm. Go ahead. Does anyone else have any questions? We can take a couple at a time. Okay, go ahead.
Hi, thanks, on the team. I think this is a really important resource for governments, especially, you know, moving forward to hand hygiene guidelines coming up for all, trying to pick what is the suitable hand hygiene facility for a particular area, information that's not there. So this is really good, and the governments usually don't have time for research to be done, to be conducted, and evaluation. They need information, and they need such documents. And so the question I have, because it's so important, as we're putting these facilities together, how involved were they in that process? Because when it comes to looking at, or really looking at uptake, the point that was raised is that ownership begins at the point of development, isn't it? So as we're looking at all these countries and gathering this information, to what extent are we involving the engineers at the Ministry of Water and Development or at the Ministry of Health who are implementing these things? In that way, you know, it's really easier to take this document and do more ownership of it. But otherwise, it's a really big resource to move forward in terms of promoting hand hygiene.
Great. I think, thank you, Janela, for these nice questions. And I think the involvement of the local government, especially from the end users' perspective, was one of the screening process what we have actually listed while including some of the technological options. If, let's say, during the installation process, if the local government especially, and then also the people with different need, people with disability, were not involved part of the design process, we actually excluded those design. And we are very much mindful that end user perspective is very vital since the inception of the design, so that these designs are context relevant, but also same times, you know, the capacity being built, the government is committed, they own, or this is my technology, my options to install. So, I mean, those considerations was actually had happened at the second phase of the campaign, and we have actually included those technology here. But moving forward, this is just then guide, right? If, let's say, specific technological options need to be selected in a specific context, and exactly what you mentioned, that discussion should need to happen among the relevant stakeholders, and the relevant decision need to be made. And also the contextualization might be needed for a specific technological option they select, and the government is center, and they have the more accountability and responsibility to deliver it, and they should be at the center, including, I would say, in addition to the government, the local users, especially with people with disability, has to be involved, so that these technology, whatever we select and installs, are more inclusive to the people with different need. Thank you.
I think we're at about time. But I just want to thank the panelists and thank you all for having this discussion. I know, you know, we had those prepared questions, but I think it's always interesting to hear from the audience because you can certainly come up with better questions than I can right now. You know, again, thank you to all the panelists for a really great discussion. I think it's really great to hear the different research that's going on, the importance of defining the roles and responsibilities, as well as how, you know, this guide can really play a role in this larger issue. So looking forward to seeing how this all comes together, and certainly, you know, now that it's launched, then again, it's another great tool in our toolbox. So I will pass it back to and Anne to close us out.
Thank you very much for everyone for participating to these sessions. It has been a good 90-minute session, I guess. Lots of learning and insights from different colleagues. Also, thanks for your questions. So 2 insights from my side. One is definitely, I think these tools are going to be quite relevant for our work, but at the same time to the sector. We'll be maybe launching, not launching, kind of, communicating and also running a global webinar series for the relevant actors into the sector. Maybe sharing through different platforms and so forth. So we'll reach out to you all while doing so. The second aspect, so we do have printed version of this guide. If you want to have in yourself, please feel free to grab one of those as you go out. With that note, happy Global Handwashing Day, everyone. Again, today is the right moment and right time for us to launch this guide. And I literally would like to thank every one of you to be here, and also my special thanks to the panelists for agreeing to be here in this panel today. And thanks, Anne, for this such a collaborative work between WaterAid and UNICEF to jointly publish this.
Great. Thank you, everyone. Happy Global Handwashing Day. And I did want to encourage you all to, because this is a research conference as well, we have a real gap when it comes to evidence on operational research and how things are being taken up. So I really encourage you to keep up the work in documenting and promoting research in these areas. It's so important to keep this work alive and feeding into the kind of guidance that's being produced. But thank you very much, and happy Global Handwashing Day.
Great, thanks. You can take these.
Thank you very much.
They're great.
Thank you.
Yeah, thank you. That was great. Yeah, I know. I missed the.
Thanks.